Hi, my name is Dilip Singh. I represent the Muscular Dystrophy Patient Welfare Society of Bengal. The objective of the society is to spread awareness on muscular dystrophy and to ensure ambulation and better quality of life for muscular dystrophy patients. We primarily aim to create muscular dystrophy hubs uh, so that a simple parent or a caregiver, a patient does not have to go to multiple places for routine visits. Typically in a complex disease like muscular dystrophy, you require a panel of professionals to take care of the patient. So he has to run around and seek appointments and reach out to different professionals. But we wish that we are able to create an umbrella kind of an organization or a special center wherein the parent does not have to run around. So we have been able to create one in Calcutta. We wish to have several such centers across the country. This is one. Secondly, most of the literature and the videos in terms of the care and support for muscular dystrophy patients is mostly in English. So what happens is the patients are not able to understand. Many of them are not conversant with English. So we have been making an effort to provide the relevant literature in vernacular language. And this is the second thing which we have been doing. Parallelly, we believe that the legislation and support from the government or the authorities has not been as much as we require. So we have been pushing the government, we have been meeting them through the legislation or through the judiciary, so that we have the required support and legislation from the government towards support of muscular dystrophy patients and other rare diseases. In terms of looking forward to a genetic counselor, in terms of support required from a genetic counselor, I would say that the counseling should be accessible, easily accessible for the parent, for the patient, and the effort should also be there in terms of making the person understand the meaning of the diagnosis, because typically just announcing a diagnosis does not help the parent. You have to make the patient understand that what does the diagnosis mean, what could be the care protocol or the cure protocol for the patient, and how do you actually help him lead a better quality of life. Typically all of this requires time. If you are not able to devote adequate time to the patient and the caregiver, they tend to fall for fraudsters who give them solutions and they promise them the world and they promise them the moon, but typically nothing happens. So there is a tendency of such patients to fall for fraudsters, and we have seen many of our families which we have been associated with who have spent lakhs and lakhs of rupees because of lack of proper knowledge or lack of proper, I would say, support system available. So that is what we would be expecting from the fraternity going forward. Thank you.